a testament to our state and our resources. I'm excited to be able to share that our zone grant was very supportive during this time in helping me bring in a sub to stay open for all the families. So I'm excited to be in Topeka next week and share that with my legislators and just continue to highlight the importance that we have.
Well, you know what, Desiree, without prompting, like you just made my day. Like that is the reason that we're all here. It's why there was the flexibility in this new grant, and when we reimagine what the work looks like, and wow, we could call it a day. Like we could be successful. The statewide pathways work, and we're done. Really appreciate that summary.
I love what I do, and I am very honored to continue to help this industry and our children in Kansas grow. So,
well, thank you for sharing that. And I'm glad to hear you're on the mend. That's the most important part. So,
thank you. I was very nervous for a little while and what this was going to look like.
I bet. Oh, well, good morning for everybody else joining. See Amanda, Kathy, Trina, Lisa, all of our KSDE friends, right? Or seeing Stacy. Everybody's joining. We will start recording right at 9, and we have a full agenda today, so we will get going at 9 as our support team will continue to let everybody in. And I have to double check. There's a discrepancy between my computer and my phone time. And so I never thought that would happen because everything should be on this universal sync, and the time is just a minute off. Okay, Lindsay, if you want to start recording.
Good to go. I found the cheat to turn off the really loud message, so I should have warned you. So here's your message.
I love that message. It's my cue. Okay, good morning. My name is Melissa Schoenberger, and I am the Early Childhood Systems Specialist with the Kansas Children's Cabinet and Trust Fund. And I also serve as the Early Childhood Panel chair. And I just want to welcome you because this is the 5th annual Early Childhood Governance Summit. And it's my first, so I'm really is the chair. I have participated in the Governance Summit as a work group and providing information. So it's really an honor now in my new role to be able to sit back and really take in all of the information and really all of the great information, because I'm going to say I cheat it because I get to see everything in advance and everything that you guys are going to share today. So with that being said, I am going to turn over today's meeting to the Children's Cabinet Executive Director, Melissa Rooker, to welcome us.
Thank you, Melissa, and thank you to all of you for your service on the panel and in all of the various elements of the early childhood care and education system in Kansas. We're very appreciative of your work. We were visiting before things got officially started about the way the system is set up to provide supports and make sure that families and providers have what they need and can connect to the resources to make sure that our children are receiving the best possible care. As Melissa said, this is our 5th annual governance summit for the early childhood system. We just believe that there's value in coming together and learning more about what the various groups are doing. We see them on charts. We know they exist. We know people who serve in various capacities, but when we compare notes and learn from each other, it's often a really valuable experience. The governance chart that you see on screen has been our North Star since probably about 2019, when we conducted the original statewide comprehensive needs assessment. We put this together as we took inventory of all the different working groups that existed and tried to make sense of the way we interact with each other. The arrows have always indicated the give and take of information, that information flows in multiple directions. It's not a one-way street. And we have always said that this schematic does not always capture each and every work group, but these are the core groups that I think are gathered today. As you all know, the legislature adopted a bill that the governor supported, House Bill 2045, last session, that set up the Office of Early Childhood. The transition planning is underway. The office will formally open for business on July 1st, but there's lots of activity happening to prepare for that day and make sure the transition is seamless. I think over time, you will see an evolution of this governance chart. It needs to adapt to recognize the movement of programs and the creation of the hub in the Office of Early Childhood. So we want this to be a living artifact, not something that we designed once and we put away. So this is really intended to create a framework for all of us to understand the roles that we play in supporting the system overall for the state. So for today, we just want to give all of you a clear understanding of how each work group operates, both independently and then how we collaborate together. The work groups have all been asked to share. We all have the same set of questions. We want to discuss some of the barriers that we face, challenges, opportunities, strengths, identify ways that we can support each other. And then we were all kind of, the fun task was we were asked to create a headline to reflect on what we think our work should look like in 10 years. So I'm excited to learn from all of you and see what you've got for all of us to learn from.
Thank you, Melissa. So with that being said, we're going to just jump right into the work groups, and we're going to start first with the Kansas Early Childhood State Directors Team, otherwise known as the All In for Kansas Kids Leadership Team in our strategic plan. And I'm going to turn it right back over to Melissa. Thanks, Melissa.
So the Kansas Early Childhood State Directors Team was formed in I came on board in 2019. I believe it actually formed in 2018. It was part of a mentoring project through the National Governors Association. Kansas was chosen as one of 5 states to be mentored on cross-sector collaboration. So the team was formed from director level leadership from 4 state agencies: the Children's Cabinet, the Department for Children and Families, the Department of Health and Environment, and the Kansas Department of Education. We teamed up and wrote the original grant application for the preschool development grant. We were successful in landing a 1-year planning grant. That's about the time I came on board. We had just gotten the news as a state, and a few weeks later, I was appointed to my current position. The work really began to do the comprehensive statewide needs assessment. We did it together. We traveled the state. We did listening sessions. We took in reports from existing organizations. We did our own surveys, site visits, you name it. We were taking information in. And we used all of that information to draft the original All In for Kansas Kids strategic plan. We also applied for and received a 3-year renewal of the preschool development grant to really take what we learned in the needs assessment, and operationalize the goals that we outlined in the strategic plan and begin to make progress towards those goals. So the state directors team has met. At first it was every week, Wednesdays at noon from 12 to 1:30, weekly from 2019 until sometime last year when we shifted to a bi-weekly cadence. We come together. It's not that we are some official entity making decisions and going forth and you know, telling people how to do things. It is a point of collaboration and connection. It keeps our agencies working together, staying up to date, being current on all of the projects that play into the early childhood system. When we have questions about how to accomplish something or how to start something new, how we want to align the work in, you know, one division of a particular agency with something we've learned is going on at another agency. It's just a really nice way that we all stay connected. So it's information sharing, just you know, catching up and comparing notes. It really has helped strengthen the coordination between the 4 agencies, which I think is serving us well. It feels like it's serving us well as we are mapping out what transition looks like and what all the needs are to make sure that the Office of Early Childhood has all of the elements necessary to be successful from day one. So we have placed value in having that connection point. I think this is another area of evolution as the office comes online. Many of the programs that we gather to discuss are moving into one spot. So I think there will be a new iteration of this team, but I don't envision it going away. So that's our purpose. Lindsay, you can move to the next slide. I talked a lot about the purpose being collaboration. I'll give you some examples. I already talked about the creation of the strategic plan. It really helped guide the priorities we wrote into the PDG grant submission and the subsequent submissions that we've had really originate with the goals of the strategic plan. We updated that plan in 2024 together. We used the state directors as a way to keep up with the speed at which events unfolded during the pandemic, and you know, made sure that we were able to do the kind of rapid response and then longer term recovery planning that needed to happen to manage a huge influx of one-time federal funding and all of the conditions that everyone was dealing with on the ground. And I think, you know, as I sat in national collaboratives to compare notes with other states, I really was proud of the work happening in Kansas that I could report on behalf of the team, because that alignment and that coordination served us so well and in ways that certain other states ended up struggling with because they didn't have something similar. So it's that collaboration has been key. Advance. So this is our headline for state directors. In 10 years, Kansas becomes a national model for flourishing families and thriving children. After more than a decade of strategic cross-sector investment, Kansas achieves record outcomes for young children and family well-being. That's our goal. We want every child to thrive. We want the work that we all do to create that tapestry of services that support families at all levels. You know, they could have kids doing great, We want to make sure those kids have opportunities to soar. If a child needs some therapy of some sort, or assistance with reading, or the family needs some kind of support, we want to make sure that it is effortless and available to be able to connect to those resources. So that's the future through the eyes of the state directors team. Melissa, I will turn it back to you.
Thank you, Melissa. And that is a great way to start the summit with such an aspirational message. And thank to the other state directors that are on the meeting this morning and setting the bar very high for the rest of us as we move forward. We are going to skip ahead as from our agenda, as we have one of our speakers joining us a moment late, and it's to the advantage because we're going to skip our ICAP and go do an overview of the early childhood recommendations panel. So I get to keep on sharing information with this group. Lindsay, if we want to move to those slides. All right, thank you. If we want to move to the next one, and we will really level set the purpose for our panel members on screen this morning, and for those joining us. We hear this every time we start a panel meeting, is to go over the purpose, because I'm a firm believer in anybody joining us through our YouTube site, that we just don't jump in, that we honestly have a level set of why are we gathering, and just a reminder that the panel serves on behalf of the Children's Cabinet, who the Children's Cabinet serves as the Early Childhood Advisory Council, otherwise known as ECAC. So if you ever hear anybody saying ECAC across our ecosystem, that is the federal requirement of the advisory structure, trickle down to the states, and that's actually devised through executive order. So there are specific agencies that have to be aligned on the panel, and then we open up the panel for anybody interested through an application process. So you will see representation from KDHE, Kansas Department of Health and Environment, Department for Children and Families, Head Start, and then other, again, interested persons who are invested in early childhood across the states. We have representation from our R&R network. We have representation from our library network across the state, which I think is really just kind of fun because it brings a very different perspective, from our Department of Education. So it's a very deep representation of the work that goes on. Professional development with Casito, again, very deep representation. We really, if we could take a minute and visualize the structure that was on screen when we first started, the role of the panel and the challenge that I share with its members is that we just don't get information. Our job is to move information through the structure and all of the work groups. So anytime a work group has questions, wants to elicit support, and better understanding, they can knock on our door and say, hey, we want to come join you, and we want to pose this question. That was a great example in our last meeting when we partnered with the Department of Education, and the panel served as a focus group as we're looking for a new commissioner in our states, and provided that valuable feedback from our agency, our local, and our work groups that we represent. And so that was just an amazing exchange, and really was really, in my mind, solidified the role of the panel. So any of the work groups that are on today and giving information, note that you can join us and say, we want to have this exchange. And then things that bubble up in the panel that we realize it's really not our work, then we will then move that work back down to the work groups, because we really want that local ownership at the statewide, with those statewide pathways. Lindsay, if you want to move to the next one. And then when we really talk about our ecosystem in our states, which you will see shared with the other work groups this morning, we have 4 work groups that are specifically looking at different buckets of work that represent the strategic plan. And we really try to align ourselves and echo that work. So we're looking at family-friendly workplaces, the ecosystem, and that is a new work group to us. Especially with the formation of the Office of Early Childhood, really wanting to make sure that there was a voice without gaps as we transition into this new age, but also making sure that just because the Office of Early Childhood is forming, that information doesn't go across the different agencies still. Because I can see Jennifer Miller on my screen right now, and she represents MCH. They will stay and their work will remain at KDHE. So we don't want to isolate the work that needs to happen across our sister agencies. And so in Kansas, the early childhood system is very deep and spread out. We have our mental health supports, which has been phenomenal in all of the different sectors in our states. There's work that's in the panel, and then also supporting through the All In for Kansas Kids network. And there was a community of practice of mental health that took place just last Friday with over 100 participants. So you can see how that work is cross-cutting, and then the panel keeps highlighting it and making sure that we are supporting all of those different points. Again, we were excited, when we saw 50. The next thing I know, I'm like, oh my gosh, there are 100 people on this just joining. It wasn't a registration, it wasn't anything. So that's how important that conversation is across the early childhood sector. And continuing, we have our targeted journey recruitment, really working with the workforce. And right now we're very focused in on childcare. And then, we will, what lessons learned there and things that we can take away from the home visiting workforce, we want to make sure, because retention for that workforce and the people to actually do the work every day is critical to our early childhood. So those are the current work groups. And then we really want to honor that we have a space for learning and dialogue. One of the first conversations that we had, that I had with the panel as the chair, is that I welcome uncomfortable conversation. You cannot have any work that moves forward without that friendly pushback. And we should have friendly pushback, and we should have uncomfortable conversation. And that really moves topics forward. And we want to stay curious, right? I want our panel members to be excited when they join us and remain curious about what's going on. Lindsay, if we can move to the next slide. So some of our initiatives this year is, we want to identify, proactively challenge in the ecosystem. We don't want to wait for permission to say what is everybody worried about as we move into this new this new decade. We really want to provide continuing family-friendly workplace efforts, looking at what's in the system already and how can we elevate and tag on to what's going on. Again, we want to continue with those mental health resources, and how can we as the panel make recommendations that support all of the mental health efforts that are going across the state. And we really want to make sure that we are hosting speakers that bring value to our the work that's going on within the panel. So we've had Help Me Grow, which was just fun. You know, it was just a great presentation because we really listened to those that are receiving and doing the work. It wasn't just, you know, just a one, you know, like here's the information, but we really got to hear from those that were doing it, and that was exciting. And then if we can move forward to the last, and I'll share our headline, which is a lofty headline. As a steady and trusted voice within the state's governance structure, the Early Childhood Recommendations Panel has not shied away from difficult conversations. Instead, it has embraced them, serving as a critical thought partner in shaping Kansas's long-term childhood vision. So, and we have really focused in on family and literacy during this last year. And so one of our lofty goals was we have championed early play and early learning spaces that in the next 10 years, we will see them in every local library across the state, because we know that that is a great point with all of our partners, because it supports kindergarten readiness, partners with the ASQ. It is a space for maternal and family health, and it's just a quality improvement. So we will transition to the next group. So I have the, you know, ability to wrap up my work and then now share another group. And I want to make sure, Lindsay, are we ready to go back? Okay, so we do have our speaker here. You will note, and we should have shared this at the beginning because it was something that I wasn't paying attention to. All of our speakers will have a countdown, so that we stay on time, and then you will get a like a your time is up little piece, and so just to let you guys know that that is something that we've afforded to you to help stay within our context. So that being said, I am going to pass this over to Family First Prevention Services, our ICAB, which really is a sister board to the panel. So really excited to have Megan and share all of the great information of what the ICAB is doing in the well-being space.
Thanks, Melissa. And yeah, that timer, it sounded kind of like an Oscar ceremony. It's like, okay, time to wrap
I'm in
up.
my red, white, and blue today, Megan, so I feel like it's very appropriate. I'm
yeah.
channeling my not only Oscars, but our Olympics, you know, like we're all gold medal winners today.
I love it.
The sound did surprise me. I did turn it off. That won't happen again. I'm so sorry.
I loved it.
I kind of liked it.
I loved it. I think it's a great way to, you know, right in the perfect timing.
Well, thank you. I'm Megan Chizik. I work for KU's Center for Public Partnerships and Research. And I, along with my colleague, Kayla Byers, who couldn't be here today, co-lead the Kansas Interagency and Community Advisory Board and support the Family Council that started through the Family First Services Act. So I will share with you, the ICAB has been around over 5 years now. It was established in early 2020. The state of Kansas, as many of you are familiar, was an early adopter of the Family First services. Kind of when it went into place, there were 5 states that were early adopters, and Kansas was one of them. So we actually have the great pleasure of having data much earlier than other states across the nation. And so a lot of other states look to us for, how did you do that? And what are you doing now? And it's been a really fun experience. So Family First is really intended to, much like it sounds like, is intended to prevent child welfare involvement or prevent children from being in out-of-home placement. It centers around 4 key areas: mental health, substance use, parent skill building, and kinship navigation supports. So it's community-based prevention services, and it does require that kids be considered candidates for care. The state is looking at different ways of creating community access, but right now it's still through DCF directly. And the ICAB and Family Council really serve just to support kind of the evaluation, the implementation, kind of what are we seeing in the community in terms of service needs and gaps and what's working, what's not working, and really help kind of make sense of that across the state. So about a year ago, a little over a year ago, the ICAB also adopted sort of a role as the working board for our Kansas Thriving Families efforts. So Kansas Thriving Families, Safer Children was another kind of national movement that Kansas committed to, I want to say in 2022, 2021. I can't even remember now. It's been several years, which is also a testament to Kansas's commitment to child and family well-being. And that's really the focus of the Kansas Thriving Families priorities is, again, it's prevention, it's upstream, it's promoting well-being. And the ICAB serves to carry out the vision of the Kansas Thriving Families priorities and vision. The ICAB includes cross-sector leaders from all regions of the state. We were very intentional about identifying members that were part of the child welfare community, but also part of the just sort of general community of social services and supports, as well as lived experts. So it really is a well-rounded group that can see kind of the continuum of needs and services across children and families across the state. Next slide. So here you can kind of see the graphic here depicts that Thriving Families is really the overarching vision, and then the ICAB supports that work. And then it also, it's hard to see, but the kind of ICAB is made up of our state agencies, serves to support the legislature. There are community and regional champions, and then lived experts. And we have 22 lived experts that are part of the Family Council who have a wide range of lived experience of the systems, whether that's child welfare specifically or just general services, early childhood, social services, mental health, what have you. And they are also members of the ICAB. So a third of the ICAB is made up of lived experts. And they really, while the Family First services and the ICAB are supporting children and families of all ages, they do support specifically the early childhood system in many ways. They serve to expand prevention services, and that extends to families with young children. They intentionally center family voice. As I mentioned, the 22 members are lived experts, and we also meet separately with the Family Council monthly. And that group is doing tremendous work, and I'll share a little bit more about that on the next slide. They bring a lot of evidence and insights. As I mentioned, we have a lot of data. We've conducted a 5-year evaluation, and that serves to support and provide evidence for early childhood interventions like Parents as Teachers and Healthy Families, PCIT. Those services are all working, and we have that evidence to support that, and that directly supports the early childhood system with those insights. The ICAB has also spent a lot of time promoting and supporting the growth of 1-800-CHILDREN, adopting that as a directory and really helping to help communities get that out there and make sure families know about it, and make sure providers are adopting their profiles so that it can be widely used and supported. And then certainly advocating for policies that improve quality, access, and family stability. DCF has been an incredible partner and co-developed a policy recommendation form with the ICAB 2 years ago, and the ICAB and other entities, any entity, including the ECAC, could submit a policy recommendation using this form. And it's a really great opportunity to say, hey, take a look at this policy, or I see you don't have a policy in this area. And it allows people to make that recommendation directly to DCF, and the ICAB was instrumental in helping make that happen. Next slide. So here are just a few areas of collaboration that I think are important to share. So the ICAB is currently, at our last meeting, we shared cross-cutting themes from a variety of community conversations. We've held the Foundations of Family Wellbeing. Some of you may have attended that, where we screen a video from Dr. Amelia Frankmeyer, and then we have a subsequent kind of part 2 version that really hones in on like understanding poverty versus neglect, and the kind of the challenges in what families are experiencing and how we can support them whenever possible. And so we're reviewing those themes across I think 12 different events, and looking at what potential recommendations that the ICAB could make to DCF and or other state agencies to consider based on the feedback that we're hearing from our communities across the state. The Family Council partnered with KCSL to look at what are family resource centers identifying their services as in the 1-800-Children profile. So are there the right tags that they have on their and they're making recommendations recently to our Kansas Family Support Network. And then finally, our ICAB is collaborating with our CanLink, which is the Kansas Linking Infrastructure for Nurturing Kids, which is a grant, it's a federal grant that serves to increase access to early childhood and thereby decreasing child welfare involvement. And we're looking at developing a child development training specifically for child welfare workers. Okay, and my headline is the nation sees historic drop in children entering out-of-home care after major investments in prevention and economic supports. And that's the dream. So.
Thank you, Megan. And I just want to give a shout out to all of the work that the ICAB does. It is just fun to be a part of and listen from where I sit. And for the panel, Megan and I have chatted about how the ICAB and the panel, we don't want to marry them, but they could date a little bit, and so that how we could be more cross collaborative together in our efforts, and how we could be, what work complements each other. And the panel will be hosting Megan again next month, as we really dig into some of the well-being work and staying on our theme of families. So really looking forward to having you back. And so hopeful with your presentation, if there's any thoughts that panel members have in advance, jot it down, share it with me, and we'll make sure that we get it covered next month. So thank you. And we will be moving on to the Kansas Maternal Child Health Council. And we welcome Dr. Jennifer Miller to our group today.
Good morning, and thank you, Melissa and the team that put this together, for the opportunity to be here and talk about our council. I'm Jennifer Miller. I'm the Title V Director for Kansas. That essentially means that the Title V of the Social Security Act provides funding to states to improve their maternal and child health system. And so I oversee the funding that we receive and how that's allocated around the state. So as part of that, we have developed the Kansas Maternal and Child Health Council. And the purpose of it is really to help advise not only the Secretary of Health, but also the Bureau of Family Health and myself on how can we improve the health of Kansas families, really geared towards that maternal and child health population. We've intentionally brought together a lot of diverse organizations, as well as different groups that have experience or are currently working in the maternal and child health space, as well as we have brought in a lot of individuals with lived experience. We feel it's really important to be able to hear not only from the folks that are the boots on the ground doing the work day to day, but also the families that are going through those systems and getting their thoughts and ideas on what's working within the system and what's not. And then that is information that we use to help build our Title V state action plan, as well as take recommendations to the secretary. Next slide. So when we talk about the early childhood system, one of the things that the council really strives to do is bring together that diverse group of folks that can share what they're working on, issues they may be seeing, programs that they're working on. So that it really offers an opportunity for us to collaborate across systems, as well as for our partners working across the state to share with us as an agency what they're seeing. And oftentimes they will identify and see gaps that we have not noticed, and often will take a lot longer to get to us than without the opportunity to hear from them. As part of Title V, we do a state action plan every 5 years, which includes a comprehensive needs assessment. So this group also really helps us in drafting that state action plan, as well as connecting us to the folks that we want to hear from with our needs assessment. They also then will routinely, when we do check-ins around our state action plan, provide their feedback on what's working and what's not. I'm a real firm believer in that if it's not working, I just want you to tell me so that we can fix it immediately, versus waiting 5 years to see the data that shows me like, hey, you invested these funds and it didn't do anything. So that's another really important piece of this. We also really strive to bring both public and private sector support to our MCH programs. This year, one of the things that one of our groups worked on in the adolescent space was promoting civic health. So they partnered with the Kansas Health Foundation to add that to some of their programming that they had for adolescents. So really helping not only address those healthcare system issues, but also looking at how do we impact positively the entire ecosystem of a child or a mother's life. And so that's been really exciting. And then also just want to make sure that we bring in other KDHE programs so that those partners also know what they are doing and ways they can collaborate with them as well. Next slide. So one of the really exciting things that we did over this last year is we have different work groups, and one of them is our perinatal infant work group. And we identified that when a newborn tests positive through our newborn screening program, there's a lot of follow-up that occurs. So they get contacted by our program, they get resources, our team also works with the physicians. But for those families that receive a normal screening, there's not really any follow-up for them. There's no connection to any potential resources that they may need as new parents. So the newborn screening program had launched a new website that just provided a lot of different resources that were not necessarily all specific to if your child screened positive. So we wanted to see if by mailing these cards out, would we get more folks visiting that site, more people being able to access resources that they might need for children across the state. So we did about 5,000 postcards and found that we had a lot of increased traffic flow to the website. More folks were visiting, looking at the different resources that were available. And a lot of this was via mobile apps. We put a QR code on that postcard, which was really successful. So now we are really looking at how could we potentially scale that up so that this is something that any newborn in the state receives, and that then parents, whether your child screens positive or has normal results, are still getting access to these resources that could be really beneficial to them throughout that infancy period. And then next slide. So when we think about our work in the future, we really want to be the leader in maternal health and family well-being. Kind of borrowing from our maternal mortality review committee work, we want Kansas to be the safest place for moms to give birth and raise children. We want families to be able to access the resources that they need when they need them in a way that works for them, that is, their ideal way. So that's really what we are striving to do with this council, as well as with our Title V funding.
Thank you, Jennifer. I'm echoing. Is that okay? I think, Jennifer, I do have a question for your initiative, because when I was reviewing our slides, that was very intriguing to me. And, we have so many work groups on, and when you were sharing that there were resources. Well, first, I love that we still honor mail, right? People still like to get something in the mail. It's not always have to be driven through some technology, and that people respond. And so that was just really heartening to know, very, very warm, fuzzy to know that people still like postcards. Second, with that QR code, what type of resources were you connecting new families with? And just trying to figure out if there's gaps or if there's work groups information that you see today that would be beneficial to connect those families to.
Yeah, so a lot of it is information around newborn screening. So what infants are screened for and what to do if you have a positive result. But they also then link to other resources like 1-800-CHILDREN, to some of the postpartum information that our Title V team has worked on. So it's really a wide variety, but really focused on that, really early infancy and our early postpartum period.
Thank you. No, actually, do have one more additional follow-up question. Was there anything about home visiting that is offered in that first bucket of information through your connection with these families?
Yes, we did include home visiting on there. Yeah, we are really hopeful to get home visiting to truly be universal, where everyone has one, and we can really develop that out. So absolutely very important to us.
Great. Our home visiting friends are on today, the state home visiting leadership team. So I wanted to check with that. Well, I appreciate all that you do. I am a new member of the Kansas Maternal Child Health Council, and it is fast-paced work, and I've really enjoyed the interaction. So thank you for joining us today.
Yes, thank you.
And we will be moving on to a group that is very near and dear to me. I've spent the last several years joining the Governance Summit, representing the Kansas Child Care Systems Improvement Team. And it is my pleasure to hand it off to Jarvis Dolman and Jennifer Manuel.
Good morning, everybody. Yes, Jarvis Dolman. I'm here with KDHE, Kansas Department of Health and Environment. We're going to be here to talk about the Systems of Improvement Team. And Melissa, I just want to say quickly, when I started in this position, I quickly was confused what the System Improvement Team was in this governance pattern overall, but you were able to help me understand that, and thank you for setting a good example for the SIT team and for us to be able to jump in and fill in for your shoes. So we'll go ahead and move into the next slide, and I'll let Jennifer start off for us.
All right, thank you. Hi, I'm Jennifer Manuel, and I am a co-director. I am the Director of Systems and Field Services for Child Care Licensing with KDHE. Also a little bit newer to this role, as I am filling the role that Melissa Schoenberger vacated about a year ago. So learning new things. So the Systems Improvement Team serves in an advisory capacity to KDHE Child Care Licensing, and they focus on efforts, that can support families and provide protections to children in regulated care. So we're looking at ways to reduce barriers for providers, support new applicants, improve our regulatory system for providers, and then, of course, our big goal is to ensure safe, accessible, high-quality care for Kansas children. We meet monthly, and it's a group of family representatives, child care providers, community organizations, some of our licensing specialists, other specialists in the field, and they help provide a broad view of the system, which is helpful to Jarvis and I as we implement their suggestions. They review protocols, look at ideas to increase efficiency, just increase transparency in our processes. And so we appreciate that work on their part. And then next slide, please.
So yeah, a little bit more about how we connect with the ecosystem. Recently, over the past year, we went out and did some roundtable discussions across the state. I think we did 6 or 7 of them across the state. We tried to hit, each of the different sectors of the state just to make sure we get those different perspectives. And when we did that, we were going out to, gather information, obviously, for the SIT team, and the SIT team is tied to licensing. But we also wanted to make sure while we were out there, we gathered information on the ecosystem as a whole. So we just didn't want to go out with a license perspective. We didn't want to hold people and pigeonhole people into just giving us thoughts on licensing. But we wanted to know all the things. We want to know the good, the bad, and what we could do better. And so, as you see on the screen there, those questions we asked is, what's working well in your region, what's not working well, and what can we do better as a state to assist you in your region. And so we heard a wide range of things. Some were licensing, some were not, and many of those things that we heard, obviously, that weren't licensing specific. We wanted to make sure we brought those things back and provided those to our partners and different organizations that we collaborate with. We wanted to make sure that those things did not go unheard. And I think that's the thing with the ecosystem, is that it's not, we're not by ourselves. And I think that's important to do when one organization or a program hears something, to make sure we pass that along. And also, we work together to find solutions for those things. Just because it's, not our work internally doesn't mean we can't get together and have conversations and think up ideas. So we'll move to the next slide. So just a little bit about the work we're currently doing and how that ties to collaboration. Through those, the roundtables we had, we took all of those ideas and those thoughts that we heard while traveling, and really tried to dive in and say, okay, what is licensing specific? What can we take from these roundtables, and how can we create work groups around those? So these work groups you see on the screen are kind of the themes or the buckets we kind of heard most from the roundtable. So the innovative child care models. What we're trying to do in that group is really look at what we can do in a licensing perspective to reduce barriers for providers. Trying to look at things differently with our licensing standards, and seeing where there's areas where we may be able to think differently and bring about different models. We've seen across the state there's different models popping up in different communities, and trying to see what we can do to reduce barriers with those models that we see popping up. One of them is, the big one is the small center pilot that we ran over the past year. We got some data back on that, and that's one of the ones we're talking about internally to see, okay, we've gotten data on this, and where can we look at our licensing regulations just a little bit differently to make this more accommodable for these providers that need these things in these different communities. And really also with that work group, one of the things we're looking at doing as well is taking those different ideas and kind of taking it out of the licensing perspective and trying to put some perspective on how these different models can bring positive economic impact to communities. I think that's one of the things that we're seeing in general, is that, we know those large issues that are really barriers for providers. And one of those big ones is funding and pay. So, how can we take these models and really take them on a grand scale and show communities, hey, these are some different models you can use. And also, this is how it can bring some economic stability to your communities. The next work group is the provider retention strategies. I think we've done a lot specific to licensing, specifically, changing regulations, updating regulations. And so, I think a lot of the focus has been on opening new facilities, but I think we forget about the providers that are currently open. So that's where this work group is aimed at. How can we keep the providers that are currently operating open? How can we show them appreciation, and working with different organizations to figure out the best way to gather that data to really see why are providers closing, what's hard for them, and what can we do as an ecosystem and collaboration across the system to make things easier for providers and help them stay open. And the last one, there's been a lot of changes, obviously, with licensing regulations and statutes. And so one of the big things we're wanting to do as a program is to show the importance of licensed care. I think individuals know that. I think all of us on this call know that, but I don't think the communities at large know that. So trying to bring some awareness to the importance of licensing, licensed care, why it matters in a child's life, and really trying to combat those changes that were made and those worries that we have of the changes that we saw with the regulations and statutes. Next slide. So this here, I think, just kind of encompasses all of our work groups. Licensed childcare facilities on the rise in Kansas, driven by demand, community investment, and provider satisfaction. So if you really, like I said, think about those work groups we have currently going on, I think that kind of encompasses all of those. And I think focusing on all those will help grow licensed care. If we're able to show the importance of it, I think there's going to be more demand for it. When there's more demand, there's going to be more community investment. And then, if we have that investment, then, providers will be able to show some satisfaction and really work on retaining providers. So and with that, I think we're done. If anybody has any questions for us.
I would just like to remind anybody, if they're interested in being a part of the systems improvement team or listening in real time, the systems improvement team is live streamed, and there's a link from I believe on the child care licensing website, and
right.
So we really encourage anybody to do that. And I do appreciate that you host evening meetings for family members. And I think the next meeting is on St. Patrick's Day in the evening.
Yes,
So
yes.
be wearing your green and join the systems improvement team on March 17th. Thank you, guys. Okay, we are going to move on to the Workforce Development Advisory Group. And we're going to have Chelsea Schulte with the Casito join us and give an update on our professional development efforts across the state.
Thank you, Melissa. My name is Chelsea Schulte. I am an associate director here at Casito, Kansas Child Care Training Opportunities. The Workforce Development Advisory Group, if you want to move to the next slide, is facilitated by Casito as part of the Child Care Workforce Professional Development Contract. This is a grant that DCF has awarded to Casito, and we've been doing the Workforce Development Advisory Group since about 2013. The goals and focus are outlined here, but in a nutshell, we're really trying to assess what's working, what's not working, where are the gaps as it relates to the early childhood professional development system. And then with that, to make recommendations, to investigate research, figure out solutions, and make those recommendations to either the recommendations panel or the powers that be, right? Or like the system as a whole, right? However is relevant, given the recommendation. So our membership includes state agencies, PD organizations, higher ed. We've got a handful of direct service professionals on our listserv, but that is something that we are always interested in having more voices from those who are working directly with children or are working in those licensed child care programs. There is, and I don't think it's linked here, but there is on the, there's a new member interest form on the Casito website, and I can put that in chat when I'm not talking because I can't do two things at once. So if anybody is interested in getting involved, you can fill out that form. We get you, anybody that's involved, we get on the main listserv to stay informed, even if you can't make it to the meetings that we host. But we also have lots of work groups that are really putting in all of that research and brainstorming and planning around specific initiatives as they're identified kind of as our large group. We meet every other month. We meet in the even months, except this month, our normal day, it's usually the fourth Wednesday of the month, but next week is Early Childhood Day at the Capitol. So we have pushed the Workforce Development Advisory Group meeting into March so that our members are not torn between where they should be that day. So the our efforts in terms of the ecosystem is, like I mentioned, really focused on the professional development system for early childhood. So looking for feedback from those that are in the early childhood field, those that are working directly with children, the directors in those programs, or staff in those programs, again, to see what's working, what's not. The Workforce Development Advisory Group, over the many years that it's been going on, has put forth several recommendations, including the establishment of a workforce registry, which we all now know as CAPE, creating a career pathway. As part of that recommendation, we realized we needed to update core competencies, and that the development and implementation of an individualized professional development plan, or an IPDP, would be necessary components for that career pathway to be valuable. So in the last year, I would say a lot of our work has surrounded this last bullet of providing feedback and recommendations for CAPE enhancements. So a lot of the work that we are talking about and doing is now, we now have this technical system that kind of stands alongside the work that we're doing. So when we talk about systems level work, we're not just talking about the way we do things, but also how a technical system can support us, make us more efficient, and benefit those that are accessing these services. On the next slide, like I mentioned, we have several work groups and we're actually in the middle kind of a transition, and our next meeting will be going over that with all of our members. But our core comps team, if you don't know about the Kansas core comps, I'm happy to send you a link. That was a very long process and well worth it, and ended up with a really wonderful product. And so that group has made it to the end of that goal. We know there's still work to be done in terms of distributing and implementing and making sure that everybody knows what the core comps are and how they can use them. But we know that that work doesn't happen in a Zoom meeting of 12 people. That's statewide effort, every day out in the field, promoting and using and finding ways to make this helpful and valuable in our day-to-day work. So the other two that have dissolved this year are our trainer approval and training approval work groups, who were created really from the space of this idea that we're getting a technical system. CAPE is going to be a reality. We're going to have a registry. What does it need to look like for somebody to be approved as a trainer in Kansas? And what standards do we have for training approval to support consistency across all trainings that are occurring? So those groups had outlined some really beautiful dreams for what this could look like. And admittedly, we had to rein that back in a little bit to fit within the scope and the budget and all of the things for CAPE, but to like really identify what are the most critical components of this. And we are always so happy. I'll speak for the group in saying that I think anybody is willing to come back to that table to talk about future enhancements as well, right? So just because we've started that process and kind of paused where we're at with it, we've got something in place that we can trial. I know we would be happy to to circle back and say, okay, so how's it working? What's not working? What do we need to do differently? That's really the nature of this group, again, to just assess what's working, what's not, and how can we do better. The other new thing this year is one of our work groups is now a program quality work group. And this was an effort to integrate what used to be a separate CCQIS advisory group that was facilitated by Child Care Aware to support with links to quality and other child care quality improvement systems. So we have kind of absorbed that as a work group now of the Workforce Development Advisory Group. It is still that work group is still facilitated by a staff member from Child Care Aware, but it keeps the connection as it relates to professional development and childcare, all kind of in the same place. All of those work group members are receiving the updates about the larger Workforce Development Advisory Group. I'm over time. My news article, my future efforts 10 years from now, is that the Kansas Early Childhood Professional Development System is recognized nationally for collaboration, feedback loops, and system coherence. So the early childhood professionals across all settings are meaningfully engaged and compensated for shaping the system. So if folks have any questions at all, my contact information is on the next slide.
I do have some questions, Chelsea, or some comments that I would like to share with the group. The panel in January, which seems like such a long time ago, was just a few weeks, just a month, we celebrated Cabe's first birthday. So I think that is important milestone to acknowledge that you know, supporting the CAPE team, you know, everybody's still standing up, and it's been a long year supporting that work, and really appreciate it. And I keep on my desk a copy of the core competencies. It's always at my desk. And I want to remind the group.
It should be for everybody, right?
Yeah.
Everybody grab your, no, I'm kidding. You don't have to do that. I won't put you on blast. But if you don't have one, tell me and we'll get you one.
We will. And that it's not a competencies just for childcare providers. It's truly competencies for the early childhood workforce. So it doesn't have to stay in one lane. So when you're looking at connecting with families and you're looking at health and safety topics, that they're not isolated to just childcare. So I really wanted to point that out. And this is a great resource for the whole ecosystem and all of the professionals that there's this amazing visual that the strategic plan has of all of the visuals of all of the different entry points and professions, and everybody can use this, and reminding everybody that CAPE is not just for the childcare workforce, it's for the whole workforce. And we really want all of the different work groups to take advantage of that. Get your workforce and professionals into CAPE. It's a delivery that we see expanding every day. And if anybody's interested in becoming a CAPE ambassador, also let Chelsea know, because I'm a CAPE ambassador, and it is a great resource as we continue to build that, so that we can get really rich data on the early childhood workforce as through CAPE. And so great work going on in your space, Chelsea. And thank you for participating today. And they will take you up on that. If anybody would like a copy of the core competencies and you've not received it, please drop your name in the chat, and we will get that to Chelsea, and we will get you a copy.
Be warned, though, if you ask, I'm also going to send you an IPDP and a self-assessment that's based on the core comps, because it really is it's a kit, right? It all works together.
Kit. Yep, and I have that next to me too. So I have it all. So love all of your resources. Okay, and that being said, we are going to move on to our next work group, which is a combination of really two work groups that work hand in hand and side by side. And you'll see that in the content moving forward, and really appreciate information that's going to be shared about the Family Advisory Council and the Kansas Family Leadership Training. And we welcome Ellie as our next speaker.
Thank you so much, Melissa. Thank you for having me today. I'm very excited to talk about the Family Advisory Council and our new initiative, the Kansas Family Leadership Training. Let's see if you can go to the next slide. So on these slides, you'll see the Family Advisory Council is on the left side, which you'll start talking about that. And then the Kansas Family Leadership Training is on the right side, and I'll talk about that next. So the Family Advisory Council, the purpose is to elevate family voice and lived experiences and inform program and policy systems. So they're really wanting to, we're really wanting to make sure it's inputted into our Kansas systems and making sure that we're leaning on the Family Advisory Council for family voice and that expertise that they do have. So we do advise partners with stakeholders and then to strengthen those family-centered practices. Our members are all parents or caregivers with lived experience. We do have some partner organization and agency representatives as well. And then we have our different work groups. So we have 6 different work groups on the council. We have our women maternal, our fatherhood work group, which is a year old now in March. That's super exciting. We have our early childhood work group, our child and adolescent, and then we have our children with special health care needs work group. And so all of those work groups do have a co-chair and then a subject matter expertise from our KDHE team that does provide some support to them. So they meet quarterly with one in person. All of these meetings are held on a Saturday, and we do provide compensation for our Family Advisory Council members. Now focusing, going to the family leadership training side. So we'll continue on that last slide there. I'll go over that one too. So the Kansas Family Leadership Training, their purpose is to build and strengthen Kansas leaders across Kansas. So really building up a army, if you could say, of family leaders that feel competent and confident in going out and advocating and making decisions for either their families or their communities. And so these developing this training right now, it's in development, and then to be launched in the fall of 2027 or spring, kind of depending on some things still. But it is in development now, and we're developing it with families at the center. So we have 3 family leaders from across the state that are helping to develop this training. We are actually sending them to Iowa this next weekend to take the training in person so they can see what this training was kind of based off of. The training in Iowa is a nationally recognized training. And so they've been awesome collaborators with us and very willing to have us take whatever from their training and move it to Kansas and make it more Kansas specific. So they are state and community partners, and they're going to be a plan of mixed in-person and virtual sessions. And then we are anticipating a cohort model. So we'll have a new cohort each year, but it is to come. And then if you want to go to the next slide, please. So back to the Family Advisory Council, the ecosystem and how it fits into the early childhood ecosystem. We really want to elevate that family voice and lived experiences to guide early childhood policies and program and system improvements. And so one way that we do that is with our work group. So we have an early childhood work group that does focus on some of these things. And so right now they're actually partnered with Help Me Grow Kansas to be able to look at screening incidences and see where are the gaps in that in those rural and frontier areas. And so they're working on a spreadsheet to be able to see which counties are getting screenings, what are they using for their tool, and how could we best support them if counties are not, to be able to make sure that we are getting in those gaps. So we also ensure services remain family-centered and accessible and responsive through ongoing feedback. We strengthen collaboration between families and early childhood partners to improve the outcomes for children. And then for our family leadership training, going to that side, the goal of it is to build a pipeline of informed, competent family leaders so they can go into these systems and to be able to advocate for their children and expanding their understanding of the early childhood systems and how they can make an impact. And so they will hopefully strengthen long-term sustainability through ongoing family leadership trainings and yeah, building up more family leaders as we go. If you want to go to the next slide, please. In our collaboration in the Family Advisory Council, we have a ton of collaboration going on all of the time. And that is really the goal of the Family Advisory Council, is to be in each of these different pods. So we've collaborated with 1-800-CHILDREN, building out their resource page. A work group is actually working on that, our Children with Special Health Care Needs work group. We've partnered with the Kansas Connecting Communities to build a Mindful Mamas guide. Our FAC members have worked on that project. We've worked with KDHE programs, our home visiting program, getting feedback on what works best for families, what do they see successful. They've completed surveys with community or care connection and making sure those pathways are complete and seeing what the gaps are again. And then they're also enhancing their early childhood system by connecting families to programs and agencies and to improve the resource and supports. And so during our FAC meetings, we usually have an inside presenter, somebody from KDHE, to talk about their programs. And then we also have somebody come in from the outside. So say 1-800-CHILDREN or Help Me Grow Kansas or KCSL, talking about the supports and services that they have available for families. And then getting their feedback also, the FAC's feedback on those services to see if they are working with families in their minds. So moving to the family leadership training side, we partnered with Help Me Grow Kansas to implement these family leaders in our program development. So how this worked is Maddie and I, whenever we were thinking about this, we were like, how can we, I wanted families to be at the center and developing this training. And Maddie was talking about at the Help Me Grow side, wanting family leaders as well as a part of the Help Me Grow system. And so while putting our heads together, we thought that they could start with me in developing this training. And then those 3 family leaders would move to Help Me Grow Kansas with a role in that system and helping improve the childcare system in that way as well. So this training will be Kansas specific and responsive to family needs, and it collaborates with state and family serving partners to strengthen the engagement and leadership in their child system. So if you want to go to the next slide, please. And these are our future efforts. I think that the first one here with the FAC, Kansas built a pipeline of family leaders across the state. And the family leadership, I think they got actually switched here. Sorry, they're different than what I looked at in my slides, but
They
family
are
voices
different. I
driven.
apologize, Allie, because
No, it's okay.
they aesthetically they needed to be flipped, and I should have warned you about that. So you're doing a
No, that
great
is
job for capturing it on the fly. I appreciate you.
No worries, that's totally fine. So with the early childhood Kansas early childhood systems are stronger because families lead the way. Family voice is driven across the early childhood ecosystems with agencies and families working together as partners. So both of these just saying that families should be at the center of all decision making because they are, center of the ecosystem and improving all of those systems. So yeah. And then the next slide has my contact info. So if you guys have any questions or have anybody that might be interested in joining the FAC or want more information on the family leadership training, I would be happy to give you any answers we need.
Allie, not too long ago, the panel, part of our resources was a link to information where you guys were actively recruiting fathers.
Absolutely, yes.
And so is that still, are those efforts still needed? Are there still gaps there? Is there anything that we can share out in our information that would help those efforts to bring those family members to the table?
Absolutely. We are definitely looking for fathers. That is one area that we're kind of struggling in is just to be transparent is engaging fathers and how do we do that effectively. And so our work group has been awesome to try to provide gathering resources so we can share out to them. But we do have plans to attend the Fatherhood Summit in Wichita to hopefully gain some members there as well. But yes, we are recruiting specifically for fathers, but also in the other work group areas as well.
Okay, well, that's good to know, and we will continue to see how we can support your efforts, and love that you continue to put the family center. I think all of that is what we all do, but you really are, that is your mantra. And so just thank you for all of your efforts in the family work.
Absolutely. Thank you for having me.
Yes. And we will be transitioning to the state's home visiting leadership team or group. And we have with us today Holly Fry, who happens to be a recommendations panel member, and Lisa Williams from KSDE. And I just always like saying, in short, it's just not the state home visiting leadership team. It's in short, it's the SHIVEL. And it makes me think like we're at some, I'm at some Coliseum and we're seeing jousting and everything, and it just brings a great visual to my mind, because I think this team is very much fighting for access to families and making sure families have resources that they need across the state, from the minute families are the birth all the way up to as they're transitioning into kindergarten. So with that visual being said, I will pass it on to Holly and Lisa.
Good morning. Thank you so much for having us today. My name is Lisa Williams, and I'm with the State Department of Education. I am with my colleague, Holly Fry, who is with the Kansas Department of Health and Environment. We are the co-facilitators for the State Home Visiting Leadership Team. And, we really look forward to telling you a little bit more about the work of our team. It dawned on me as I was listening to the other presentations, really, we didn't have a slide in here to talk about what home visiting is in general. And so before I jump into the slides, I just want to make sure that I lay the groundwork for what home visiting is in the state and how we're part of the ecosystem for early childhood. Like Melissa mentioned, we serve families. Our home visiting professionals serve families from prenatal to to kindergarten entry. So not really even just birth, but many of them are working with the families prenatally. And our goal is to help a family, support a family where they're at with their needs, to help get their child or their children ready for kindergarten entry and their educational journey. The home visiting programs in the state of Kansas really do that in a variety of ways, but just speaking generally, the programs really support the family with their individual needs. Every family is different, and every family can benefit from the support of a home visiting professional walking alongside them to help support their children and understand uh, how a child develops, how the brain of a child develops and works, and what each family can do to support the development of their own child. So that's done through home visiting programs in a variety of ways, but the focus is always on the family and their individual needs. We do that through screenings, connections with the community, focus on parent-child interaction and child development and milestones, and also a focus on literacy to help those kids and families be ready for kindergarten entry. So that's just a little snippet of what home visiting is in the state. But I'll get on to the slides so that we make sure we have plenty of time to cover the information that was intended to be covered in this presentation. So we're the State Home Visiting Leadership Team, and our purpose is to recommend home visiting practice, policy standards, and systems improvement to make sure that every child thrives in their early childhood years. So the next slide, please. In the state home visiting leadership team, we have a variety of members. You can see that the first 4 bubbles are state agencies, and these are state agencies that have a role in home visiting in our state, likely through either grants to home visiting providers or through model guidance and implementation support. So we've got the Kansas Department of Health and Environment, the Kansas State Department of Education, Division of Children and Families, and the Kansas Children's Cabinet and Trust Fund. As you heard earlier in the presentation, the Office of Early Childhood, the implementation of that office is going to bring us all together under one roof. And that's really exciting for our state home visiting leadership team. So in addition to one thing I did want to say, that the programs, the home visiting programs that these 4 state agencies administer really range anywhere from a few visits. We call it short-term home visiting, which can include 1 to 6 visits, clear up to 1 to 5 years of working with the families that are involved in the programs. So we do have a span of programs that are offered in the state. And the goal of one of the goals of the state home visiting leadership team is to really leverage that to meet the needs of each family. In addition to our state agencies, we have, you'll see the next 3 bubbles are associations and agencies that provide direct support to the home visiting professionals in the state. So we have the Kansas Children's Service League, the Kansas Parents as Teachers Association, and the Kansas Head Start Association. And again, they are the agencies that associations that provide direct support to the home visiting professionals. And then lastly, as part of our home visiting leadership team, we have the Kansas University Center for Public and Private Partnerships, KUCPPR, and they provide us with the data that we need, the needs assessments, and the administrative support to really tackle the collaborations that are done in this group. So our goal, you can see, participating organizations work to align home visiting service models to better meet the needs of our families. With that, that makes up our membership. I'm going to turn it over to my colleague, Holly Fry, and Holly's going to tell you a little bit more about the work that's being done in our group.
Thank you, Lisa. So we're excited that home visiting is a key component of the All In for Kansas Kids strategic plan. And based on that plan, the state home visiting leadership team has chosen kind of 4 priorities to advance in our work. And those include workforce, statewide expansion, so that making sure every family in Kansas has access to home visiting services, advocacy, and family capacity, which is like converting those referrals that come into home visiting programs into enrollments. And so to share a little bit about what our activities look like for those priorities, when it comes to expansion, we are working with the University of Kansas Center for Public Partnerships and Research to collect data and put it into nice visuals, maps of the state to see where there are gaps in home visiting services being available. And using that information to make good decisions about where to expand programs to. We've also partnered to promote what is currently MCH Universal Home Visiting grant to make it known among lots of different organizations so that there is more opportunity to apply and provide services in those areas where they don't exist. For advocacy, we are getting really close to Home Visiting Programs Advocacy Day at the Capitol on March 4th. And the information for that day and the registration has been shared in the All In for Kansas Kids newsletter. There are still spots open. And so we would love to have lots of people join us. It's going to be on the second floor rotunda in the north wing of the Capitol from 8:30 to 1, I think. I'm getting my information here. And it'll be an opportunity to network with other home visiting professionals, meet with lawmakers, and learn about the different home visiting models provided in Kansas. So join us if you can. For workforce, we did something new with the Kansas Home Visiting Conference this year. In the past, it's been held virtually online using the Whova platform. And it's been really great, but we wanted to convene folks in person and give the home visitors that work under the various home visiting models in the state the opportunity to come together face to face in their region. And so we held the conference in 5 locations on the same day. Home visitors came, didn't have a long drive, didn't have to have an overnight stay, but they got that face-to-face training content. We had speakers join us virtually so that they could be virtually in all of those spaces at the same time. We had around 400 in attendance, which we were ecstatic about, with this being the first in-person conference. Let me see what else I wanted to say. We handed out folders with Help Me Grow information and Family Advisory Council information. So we are partnering beyond the home visiting models as well, and are super grateful for the other groups and other presenters on the call. I think we've already gone over, so I will stop there. And Lisa, you have at least one more slide.
Thanks, Holly. Well, in this group, we dream big. So this is our headline. We've intentionally talked about the next 10 years. And you can see that in this slide. We want the next decade of home visiting to pay off. We want home visiting to contribute to improved maternal health and early childhood outcomes. And we want Kansas to achieve a systems level coordination of our services. And this will mean that we are meeting every family that wants to engage in home visiting exactly where they're at, not only geographically, but in life. So this is a little bit about the State Home Visiting Leadership Team. And thank you for having us today.
Thank you, Holly and Lisa. And for panel members, we're going to dig deeper into the value and those serving families in April, when we invite the home visiting leadership team back to the panel to be a more in-depth conversation. Holly, I know you did mention the March 4th Home Visiting Advocacy Day, but I also want to, for panel members who can't attend the in-person event. Also wanted to share that on March 2nd, the Early Childhood Caucus within our legislative body is going to be hosting the home visiting, and correct me if I'm wrong, I think the theme is impact on brain development for children.
Yes.
Okay, see everybody nodding, and that's can be streamed. So if go to the day events, and you're able to find the link on the legislative YouTube website. So encourage anybody who even just curious about child brain development and what is a state that we can do at any point, and listen to those presentations, because I think they will be valuable to everybody who's on screen today. And looking forward to all of the events that we have coming up in the legislative process that highlight all the work of early childhood. So thank you, guys. And we will be then transitioning to the Kansas State Interagency Coordinating Council and welcoming Kathy and Stacy to our session today. So I will turn it over to the state ICC.
Good morning. I'm Kathy Kirstenbrock-Osmeyer, and I'm chair of the Kansas State Interagency Coordinating Council. We're also referred to as the Kansas Coordinating Council of Early Childhood Developmental Services. And Stacy Clark, who I know is also on here, she serves as the coordinator and the staff for the council and is truly kind of the hub of all the work that we do. And we appreciate everything. And I'll probably call on her to see if she has anything to add here in a little bit. The Kansas State Interagency Coordinating Council has a mission, and it is to ensure that a comprehensive service delivery system of integrated services is available in Kansas to all children with or at risk of developmental delays or disabilities from birth through age 5 and their families. The state ICC is established in both federal and state regulations and is funded by DCF, KDHE, and KSDE. An interesting thing to know is that this council was formed in 1986, which was prior to federal requirements and regulations for a council such as this. The program serves Part C, which is special education, infant toddler services, and of course the big focus is on home visiting and coaching. And then also Part B, special education 619, which serves children ages 3 to kindergarten. Now, in addition to the state ICC for that age group 3 to kindergarten, we also have a sister group, which is the State Special Ed Advisory Council, which is at KSDE, that also focuses on those services. And so we work as partners in that shared responsibility. The council supports 29 infant toddler programs and collaborates with the local interagency coordinating councils for those programs. We also work with the transitions from the program birth to age 3 into school age special education, which is 3 to 21. And so transition is also a large part. At the Department of Education, we work closely with Angel Span, and she's the 3 to 5 early childhood special ed contact there. And then at KDHE, we work closely with Tricia Wagner, who's the infant toddler services coordinator. Next slide. The coordinating council really focuses on systems and works in many areas to support early childhood and really focuses at the community level. We are required by state law to collaborate so that families can access needed resources. And we work to help those councils as well as other partners in communicating about child find and screening, working to help those councils be a center point of contact for the early childhood community and all the efforts that are going on locally. And of course, making sure that everybody knows about the availability of infant toddler services. Our council has a number of committees. The committees that currently we have in place are a Medicaid committee, systems and services, categorical aid, early childhood, least restrictive environments, and then a local ICC committee. Next slide. Again, statewide collaboration is really important. We work with higher education, childcare, Head Start, community organizations, state agencies to identify early childhood workforce needs. We partner with Casito to deliver professional development on special education services to childcare providers. And then we also host the local interagency coordinating council fall retreat on key topics every fall. And last October, we had a program on screen time, and it was really well received. I think we're going to do a similar one again this coming fall. And there were over 200 participants on that statewide Zoom. So we really want to continue that going. We had parents and we had providers and partners from across the state. Now, earlier you mentioned the barriers, the challenges, and those can also be opportunities, but we really find that for many of us here today, we all serve on multiple organizations, councils, and task force. And I think one of the things that we always have to keep doing and listening to everyone here today, and it's been very helpful, is to know who all's out there and who we can partner in with so that we don't duplicate each other's work and that we're coordinating and doing things to work smarter, not harder, and pulling all of our efforts together. And one of the things that we've really been focusing on in special education piece is the workforce. And so this topic has come up on several occasions as it relates there. So that can be, like I said, a barrier, a challenge, but also an opportunity. So I wanted to be sure to mention that. Next slide. Again, a headline, fewer kindergartens require special ed services as developmental readiness improves is certainly where we're wanting to go, as well as young children with identified special needs are going to enter kindergarten at the same developmental level as their typical peers, and that highly qualified and prepared EC providers in both general and special settings are able to serve the unique needs of all students, including those with special learning needs. So that's a big lofty goal, but I think it's possible if we all keep working together and brainstorming on ideas. Again, Stacy is on there. We do have a website, and I bet she'll drop that website in the chat that has all of the information about the council. And Stacy, do you have anything you'd like to add?
Yeah, I'll just reiterate that there's an LICC, a local interagency coordinating council group in every community that covers every community across Kansas. So I really encourage you to encourage your people out in the field to connect with their LICC. They go by a lot of different names, Early Childhood Task Force, and just participate so that we can get the information to others about all the services that are available to our families and children.
Thank you.
Yeah, thank you, Stacy and Kathy. I participated in the fall retreats and it was so good. I mean, the topic was well received, the screen time. I know there was a sense of, oh my gosh, look at how many people are registering, but you guys, similar to the home visiting conference, were able to take a virtual event and make it feel like it was right there in front of me. And so I really appreciate all of the work that you are doing. And Kathy, I just want to share with the group, I did not pay you to say that about the work smarter or work smarter, not harder, and you know, the cross collaboration, because truly that is the spirit of this. When we look at the state pathways, that we are not in isolation, that we are really looking at how can we collaborate. We all have our own lens because that's just the way our work pushes us. But what can we do together to make the most impact? And I think we're seeing that with some of the common threads of the workforce and how we are trying to move that for the collective versus just our own work. So I appreciate your words and really put down the challenge of how do we do that and how do we keep with these state pathways. So thank you, Kathy. And then our last group presenting today is really what I like to call our backbone of keeping us all informed in our ecosystem. It's our All In for Kansas Kids communications team who offer our webinars, who offer the newsletter, who really support the web presence that families and partners can go to and then link off to all of these other great sites and resources in our states. And we have invited Julia to join us and give an overview of all of the work that our communications teams are doing, so that if your work group has wants to highlight and get more involved in the All In for Kansas communications, for example, this winter the home visiting team is doing lots of snippets in the newsletter so that their information gets spread out across the states, that you guys have that connection. So I will hand this off to Julia.
Thank you so much, Melissa. And yes, we're always looking for newsletter content. We're always looking for webinar presenters. So when my contact information gets put up on the screen at the end of this, please write that down and you can email me at any time. So again, my name is Julia Gruss. I am a research project coordinator at the Center for Public Partnerships and Research. And I am in charge of planning those webinars and also collecting the content for the e-newsletters. So just to start off, All In for Kansas Kids connects families, the workforce, and entire communities as we work towards making our shared vision of building better futures where every child in Kansas thrives and making that vision a reality. So we send out the All In for Kansas Kids e-newsletter on a weekly basis. It gets distributed to over 3,400 Kansans across the state. If you want to sign up for the e-newsletter, if you don't already receive that, you can do that at the Children's Cabinet website. And I'll get that into the chat in a second here. But those go out every week. There is early childhood systems updates, conferences, professional development opportunities, resources, funding opportunities. As much as we can get out to you, we want to get you that information. So that goes out weekly. Typically, it gets sent out on Monday. And then we have our All In for Kansas Kids systems building webinar, which is held on the second Wednesday of each month at noon. And I just want to give a little bit of background on the webinar, kind of why it started and when it started. So the All In for Kansas Kids systems building webinars were created as an engagement strategy in 2019 when Kansas received its first preschool development grant. Broad engagement was sought to inform the creation of the Early Childhood Strategic Plan and involve early childhood partners across the state in efforts to strengthen our early childhood system. Communication channels were continuously used to recognize geographic diversity and include as many Kansas voices as possible. Kansans also stayed engaged through these bi-weekly webinars. They did used to be bi-weekly, but we changed that, I think, back in 2023. An online form and also social media platforms and our weekly email updates. During the COVID pandemic in 2020, I know that the All In for Kansas Kids webinars were a source of information sharing for state partners as the early childhood system navigated some new challenges. The webinars then just became a staple for communication about preschool development, grant activities, the early childhood strategic plan, resource sharing, and a wide variety of early childhood efforts across the state. You can go to the next slide. So this just gives you a little bit about the ecosystem of the All In for Kansas Kids communication. our statewide reach and support, connecting early childhood champions with professional development, grant funding, resources, supports, and other initiatives across the state. Our engagement metrics there. So on average for our All In for Kansas Kids webinar, we usually get about 70 attendees on average. For at least in 2025 we did. And then 4.4 thousand views on the Kansas Children's Cabinet YouTube channel with 43 new subscribers in 2025. The newsletter also actually went out, like I said earlier, goes out to about 3,400 Kansans weekly. We did put out a survey at the end of last year to get some information back from the community to see where we could improve, what new presenters people wanted to hear from. And one of the results from that survey is that 100% of the survey respondents did say that the webinars were helpful, with 63% or 68% saying it was helpful and 32% saying it is very helpful. And you can see that quote on the screen there. I'll just read it. This was from one of our survey participants. It's difficult to know everything that is happening and resources that are available for children and families birth through 5 across the state of Kansas. This webinar, its resources and content help coordinate efforts with service providers to the communities and children and families who live in them. I enjoy this time to learn about other programs and opportunities that are going on in the region and in the state. You can go to the next slide. These are just some topics from 2025 on what our webinar presenters brought to us and spoke about. As you can see, we do try to reflect a variety of content areas through our webinar presenters, and we are always looking for new topics, perspectives, and presenters for those webinars. So we just kind of separated it out into some content areas here: collaboration and community. We had a school district and child care panel. Public libraries came in, the public library came in and spoke about resources. We had a presentation on the Child Care Systems Improvement Team roundtables that happened last year, and Kids Collective. Under family and child support, we had Family First and the Family Strong work, Help Me Grow Kansas, 1-800-CHILDREN, and Ellis County's Child Care Task Force. Professional tools and resources, the IPDP, advocacy tools and tips, the well-being pathway, and then specialized services. We had a reflection on the CARE conferences that happened in 2025. We'll be learning more about the conferences that are happening in 2026 at our webinar in March. So come check that out. And then also mental health, perinatal support services, and starting strong for young children with vision loss. So we really do try to bring a variety of content areas and topics to the webinar. So again, if anybody has any presenters that they would like to hear from, or any topics, areas of content that you wanted to hear about, please send me an email because we are always looking to find new people to come and speak at the webinars. You can go to the next slide. Our future efforts, really, we just want to drive resource connections across the state. We want to continue getting the resources to you that can best serve you and help you and the early childhood system thrive in Kansas. And so, yeah, we hope to keep it going. Obviously, we've been doing this since 2019. So we're well on our way to a decade of the All In for Kansas Kids Systems building webinars. But yeah, I think that's good for that side. You can go to the next where my contact info is. jgruss@ku.edu. So like I said, please, always looking for content for the newsletters, always looking for new and fresh presenters for those All In for Kansas Kids webinars. But that is all I've got. If anybody has any questions.
I appreciate your spirit, Julia, for always tackling topics that and making them such a when you get on the webinars, such an open engagement. And so honestly, sometimes I want to mirror our panel to what you do in the webinar. So I appreciate everything that you do, and we will make sure and keep sending you topics because we do want that to continue. I remember during COVID, the webinars were such a connector. And when there was a time when things weren't happening, but you could get on the webinar and you could connect and you could listen and you could be a part of that. So that's how I became ingrained in understanding the value of that webinar, and appreciate again all that you've done to move that forward. And when you say a decade, wow, your headline, yeah, you're there. Like you're gonna have a celebration, and we're gonna be, 2036 will be here before we know it. So thank you, and glad you could join us because I think it's nice to meet the backbone, the person that is making all of that magic happen, because it is a lot of work to keep us all connected. So, as was shared earlier by Melissa, we asked all of the groups, like, what could the panel do? Like, it's not to just hear what all of the great things that are happening, but I elicited from each of the group, like, what are barriers? Like, what are shared, or what are barriers? And then I looked at how there's some shared topics and some themes of the barriers across the state, because I want to challenge our panel members to think about that, to think about where we are with our work groups and what could we be doing with efforts. And I think this, again, Kathy said it so nicely as we move into this, that the shared barriers are an opportunity. We shouldn't just be like, what do we do? We have this roadblock. Because when we were looking at the panel's headline and really talking about kicking down doors, like how do we kick through those barriers, and how do we keep these state pathways moving? So some of the shared barriers I wanted to go over and challenge our panel to think about this as you guys move into your work groups through the rest of this year, is recruitment, retention, compensation, mental wellness. And that's supposed to be lived expert representation, not lied. So we're not saying our experts are lying, that it's supposed to be lived. And I just caught that typo, and we will fix that before we get that on our website. But these were common themes that we heard today too, right? Everybody was talking about retention in the workforce, and whether or not you spoke about mental wellness, it's there in everything that we do. And then coordination and communication gaps. That's why I think it was really, really important to have Julia and the communication teams join us, because there are opportunities to highlight and share the work, and maybe where things you need extra support. Asking Ellie about what does the family leadership team, because families are busy. This is our day-to-day work. So we show up every day to do our work. But families are going to their everyday work, and then we're asking them, like, we want you to be a part of this circle, and figuring out how we can better engage families with limited resources. And then need for stronger feedback loops. We think we're doing great because we're in it every day, but we may not be doing everything great. And so having those feedback loops within our own work groups, within our own sector, and then asking others to come in and say, hey, does this make sense to you, what we're doing? I think we don't take enough advantage of feedback loops. And there's a great resource that we've all interacted with, Sarah Gardner, at KU CPPR that speaks to systems work and feedback loops. And, I definitely appreciate that resource that she shared with me, and want to make sure that we are continuing those feedback loops, and hearing the good and the bad, and as Jarvis said, the ugly that we're doing, so that we can do our work better and with more intention. And sustainability needs. It's not uncommon when we look at grant resources, and they have a finite amount tied to them and specific deliverables. But how do we continue those efforts after those grants disappear? And then after, quite frankly, if a person disappears, and who is leading the work group should be sustainable, and the structure and the leadership in any work group should happen. If there's somebody retires, somebody moves on to a different sector, it's still important that sustainability of our work groups continue, and that our work matters. And as Kathy said, preventing duplications. Geez, it has been a long day. But making sure that we are not, exhausting each other's efforts, and that if we have common themes, we come together and we say, hey, we've all been discussing this, and how can we do better, and that we are building infrastructure that goes beyond us. Kathy, I saw your hand came up. Did you want to share something?
I was just going to give you a thumbs up, but I didn't have that option, so.
Well, thank you for the thumbs up. And engagement barriers. We heard from Ellie, we know that engaging families is difficult, but engaging fathers might be a more of a challenge, but their voice is so critical to this work too. So what can we do in those efforts? And need for broader representation. That was a common theme across the MCH and the EC lifespan when we put in some of your comments on barriers. So what can we do within the state pathways and the panel? And then now that you guys see these common barriers, what can you do within your work groups? And training and measuring needs. Mandated reporter education was a well-being pathway, but we all work in a workforce. I think about home visiting and childcare licensing, where we have a workforce that is mandated reporters. And what does that mean? And how do we train that workforce so it's a common effort, in partnering with KCSL, who does that on behalf of some of that mandated training on behalf of DCF. So again, thinking, that mindset, and making sure that we have a training that is clear across the EC workforce. And then shifting from the hotline first back to the mandated reporting, and then identifying unique training topics. What is a common training topic? I think a good example is the state local ICC fall retreat. Many of us are not connected with our local ICC, but their common training platform with this screen time was important to all of us, whether you're a child care provider, whether you're a home visitor, whether you are on the MCH. Limiting screen time was important, and you saw that by everybody enrolling and wanting to be a part of that topic. And so really making sure that we are sharing information, and that when we have those opportunities that go across the ecosystem, that we're not keeping that information to ourselves. And that we're broadly sharing, even though I'm sure at one point it was like Stacy and Kathy were like, is our registration going to keep going up? Do we have this capacity? What does our platform, what will they allow? And those were in, new barriers, but one that was amazing because then we got to know joining the local ICC retreat. We got to know a little bit more about the state ICC and their role and function, and what they do at the local and the state level. And we had a great training. So, and I see that happening with the communications team. So these are barriers that the panel, and I'm challenging our panel members that we're not just going to, we accumulated them for the governance summit and now we're going to tuck them away. No, we're going to keep looking at them and seeing how as a panel we can continue to address them in our work groups and the broader work that we do. And so I'm going to pause and ask for any reaction and feedback today from these barriers. And while we still have some of our work groups on, and hear from our panel members and how they enjoyed today's summit, and what we could do in the future. And I will ask for somebody to come off mute. And if you do, please remember that we are this is an open meeting, so identify yourself and your organization. And if not, I might just ask somebody. So you know me, I like to engage everybody. So wanted to, again, pass this back to our panel members for some reaction. Okay, so I will engage somebody. I see Natalie first on my screen. So Natalie, what do you think as a panel member regarding some of these common themes and what we've heard today? What can the panel do as some next steps?
Sure. Well, oh, can you hear me?
Yes.
Okay, perfect. Sorry, I've got different earbuds in today than I usually wear. So I think one thing that's come across several group and is reflected on the screen is talking about we often have several groups across different systems working on the same thing. I think one group that we have on our panel that's approaching a workforce challenge has found that there's several groups working on workforce. And through the panel, we've been able to kind of pull some of those groups together so that we're all on the same page and kind of working together. So I see our panel approaching a lot of these challenges. And I think like the longer the panel goes, the more we're able to address some of these things. So I think we're doing it. We're working it.
I appreciate that insight and that, like, yeah, we are working it. So, and we're working hard. So I appreciate that, Natalie. Abdul, you oversee the ecosystem team.
Correct.
You are our chair for that. Anything that, stuck out to you today with all of these presentations that you can apply to the ecosystem work group that you are chairing and what you're doing?
Yes, when I see all these different entities working in not necessarily silos, but collaboratively on similar projects, what I see is that if we can bring it all under the house of early childhood development, right? But not necessarily blend it. One thing that I notice is the groupthink, and I want to always avoid groupthink. I do think that, especially being on the urban side of Kansas, Kansas City Metro, but then I went to school at K-State, and I had a lot of Western Kansans who went to engineering school with me, and some of the best engineers are farmers. And so making sure that as we pool our knowledge together, we still keep enough diversity in our thinking, but come together collectively. So that, I know that's hard to all put in one word, but that's what we're working to do in the ecosystem, is not to just blend everything together, but to really enhance everything that we're doing.
Thank you, Abdul. Yeah, yeah, you're just out suddenly from the very urban part and just, in Manhattan, Kansas. So I love a good K-State reference. So I appreciate that. And you're right, it is making sure that we're enhancing, because every work group that we heard today serves a purpose, and in supporting our early childhood system. But it's, again, how do we enhance that? How do we collaborate, and make sure that we're not stepping on each other's toes, but we're still working hand in hand. So I really like that. And is Kim Kennedy still here? Or anybody from the recruitment work? I don't.
Hi,
Hi.
I am here.
Okay, Kim, I was just, your work group just met yesterday and was really discussing the workforce. And I didn't want to know if there was anything that you learned today that your work group was like an aha, and we need to learn more, or we're on the right track.
Yeah, lots of great information today, and our work group had a really good discussion yesterday towards next steps. And I think it's today's information is mostly just confirmed what our group has identified is there's all these various systems that are looking into improving workforce recruitment and retention, and seeing other partners out there that we can tap into and work together towards the common end goal. And I believe Natalie touched on some of those things a little bit too, but mostly I just feel excited and motivated for those next steps. So.
Well, thank you. That I won't pick on anybody else. If anybody has a desire, they can raise their hand. If not, Lindsay, let's go ahead and move to our next slide.
I actually see a couple of hands raised.
Okay, I do not see them. So if you.
I can help.
Okay.
So Melissa Martin is first.
Perfect. Thanks, Melissa.
Sure. Melissa Martin with Sparkwill. So ditto to everything that all the others from the panel have just said. But one of the things that has really struck me as something of a next step is I want to take the slides after this, take the slides and my notes and do some cross mapping to the other groups that are working on something either the same or similar to what my work group is working on in particular, but I think it might be valuable for all the work groups. And then do some, not necessarily add extra meetings. I know everybody is busy, but share invitations to the existing meetings of the work group or the other group, because it occurs to me that, challenge A or B that my work group is having might have been solved by another group, and we've not heard about this, and their challenge, C and D, we might have figured out and could share that with them. So I think it's been a really interesting, I feel like every time we do something like this, I learn more. I mean, obviously, I know there's an ecosystem out there and people are doing related things, but today was a really solid depiction of that and how we could work together more effectively. So.
Oh, I love that, Melissa. And I could not echo the need to do a good crosswalk is amazing, because this is how I got our common themes. And I really appreciate the work that you're going to do, and any group that you want to connect to, please let Lindsay and I know, and we can make some of those natural bridges. So I really look forward to hearing more about the next steps within your group. And I can now see Desiree's hand. I was on the wrong screen. Desiree.
Desiree Straight. I have enjoyed today very much, and I just wanted to share that as a home family childcare provider for Kansas, I spend a lot of time getting to know the ins and outs of what I do, and being able to hear all of the groups that are out there that I wasn't aware of that are supporting what I do as well, and the families that we care for. I plan to take so much information away and like share it and explore it, and I don't know, I just hope everyone else is getting that as well. And as I've worked on the work group that I've been working with, and you know we're always continuing to learn, lifelong learners. So I just wanted to share that.
Well, I appreciate the warm thoughts, Desiree, and we are very lucky as a panel to have your lens and expertise as a family child care provider in our group, along with April. So really appreciate what you guys do. Stacy.
Yeah, I'm Stacey Clark. I work coordinating the SICC, and I just wanted to say I ditto what I think it was Melissa was just saying. Like throughout this meeting, I've been making lists of people I need to reach out to and make connections with. People have been sharing resources, and I've been gathering them. So thank you for this and for our ability to do that. I also wanted to point out a bright point in that I noticed how many groups were saying that they support 1-800-Children. And I think that that is great that we're not all independently trying to keep this list of resources, that we truly are all working to get the good resources, get the resources put on 1-800-Children and directing our families there. Now, if we could just get 1-800-Children magnets on every refrigerator in every family's home, that would be amazing. And then just one last thought, Melissa, since I have you on here. It would be really fun to get one document that has all of our headlines on it, just to inspire us and keep us focused on the great things we've talked about today.
So you read my mind, Stacey. That is, well, first of all, let's talk about the 1-800. I'll challenge Jennifer Miller to, they're doing the great QR code with families at the very beginning. Like, how do we get that? You have a postcard, so maybe we can figure out some cross collaboration for that effort, since you've had such good efforts there. But there is on the Children's Cabinet, there will be website, there will be a summary of the governance summits. And Lindsay and I were just discussing earlier of doing a visual of everybody's headline. So we will work on that. And we would also then share that out for you guys, because I think it is great to not just have it on our site, but to have it as part of just to share with your groups, so that they can be inspired and thinking about all of the good things. And we should make a commitment that in February of 2036, we all revisit that headline and see where we are. And hopefully we have exceeded all of those. They're pretty lofty goals, but I do think they're doable, and we will see where we sit. But yes, we can do that, definitely, Stacy. And we will be in our slide deck. Everybody has asked, I will share this link. I will do that. We will embed all of our links that we've talked about in our slide deck before we make that public. So everybody, when you can go back, and you will always have those resources, and you will have the contact information of all the work groups. Lindsay, if you want to go to the next slide. Okay, so in just echoing what I shared, keep an eye out for the Early Childhood Governance Summit event summary on our website. If you have questions, you can email Lindsay. She is amazing at getting all of the information up and out, and we will continue to stay connected. But my promise to the work groups and my promise to the panel is like, this isn't a one and done. We will continue this spirit of collaboration, and we will continue looking at those barriers and challenge every work group to do what Melissa and her group are doing. Melissa Martin, we have too many Melissas today, so I should make sure and say Melissa Martin to say so that looking at that cross collaboration and that crosswalk of what you can do within your work groups. And then that being said, if we want to go to the next slide. We are going to adjourn for the day and encourage you to stay up to date and put another plug for all of the work that Julia does on the All In for Kansas communications team and the newsletter and the webinar. So you have links to subscribe if you're not already a subscriber, and please share that within your work groups. And then bookmark the Children's Cabinet and the All In for Kansas Kids information because there's always great information coming out weekly. And thank you for joining us. And it was a true pleasure for me to host this as the recommendations panel's chair and say I learned something too. And really feel inspired by not just the Olympics, is why I have the red, white, and blue on today, and feeling very patriotic because shout out to the women's hockey team yesterday. That was a great, amazing just event to watch and be a part of that and want to be a part of this. And I'm going to continue to cheer on the early childhood work that's going on in Kansas. As I said earlier, everybody gets a gold medal today for all of their work and efforts. And so appreciate everybody. And thank you for participating. All right, and I think everybody is free to hop off and